Welcome everyone. Today we are going to understand Leishmania Donovani, the causative organism of visceral leishmaniasis, also known as kala-azar, using this visual mnemonic scene. Instead of memorizing scattered facts, we will decode this image like a story. Each element you see represents a high-yield exam point. Let's begin. Imagine standing in a street where a strange van is parked. On the van, you can read the name, Dono's Leishmania van. This is your first clue. The word Dono represents Donovani, and Leishmania sounds like Leishmania. So this van directly points to Leishmania Donovani. Now look at the man standing near the van. He appears sick, tired, and uncomfortable. This character represents the patient with visceral leishmaniasis. Notice something unusual about him. His abdomen is enlarged, and you can see labels pointing to the liver and spleen. This is one of the most important clinical features. Leishmania Donovani causes massive hepatosplenomegaly, especially a huge spleen. So whenever you see this bulging abdomen with liver and spleen, think kala-azar leads to massive hepatosplenomegaly. Now look closely at the van. You will notice the words black fever written on it. This is another key clue. Kala-azar literally means black fever. Patients often develop high, irregular, spiking fever, and in some cases, darkening of the skin. So the black fever label reminds us of Kala-azar leads to high fever and characteristic presentation. Now shift your attention to the left side of the scene. You will see a sandbox with a large sandfly. This is extremely important. Leishmania is transmitted by the bite of the female Phlebotomus sandfly. So the sandbox and sandfly together represent transmission via sandfly bite. Whenever you see a sandfly, immediately think of Leishmania infection. Now look at the animals around the scene, especially the dogs. Dogs act as reservoir hosts for Leishmania in many regions, so their presence reinforces the idea of zoonotic transmission. Now let's move to the most important microscopic clue. Look at the magnified circular image. Inside it, you can see macrophages filled with small, dot-like organisms. These are labeled as amastigotes, also known as LD bodies, Leishman-Donovan bodies. This is the diagnostic hallmark of Leishmania Donovani. The parasite exists inside macrophages in its amastigote form. So remember, intracellular amastigotes inside macrophages equals Leishmania Donovani. Now look at the lower part of the image. You will see a container labeled stebo-glue. This is a clever mnemonic for sodium stebogluconate, one of the treatments for leishmaniasis. Next to it, you can see a poster labeled amphotericin. This represents another important drug, amphotericin B. So these two visual cues remind us of the main treatments, sodium stebogluconate and amphotericin B. Now let's quickly review the entire mnemonic scene. The Dono's Leishmania van represents Leishmania Donovani. The sick man with enlarged liver and spleen represents massive hepatosplenomegaly. The black fever sign reminds us of kala-azar with high, spiking fever. The sandbox with sandfly represents transmission via the Phlebotomus sandfly. The dogs suggest reservoir hosts. The magnified macrophage filled with LD bodies represents the diagnostic intracellular amastigotes. And finally, the stebo-glue and amphotericin represent the treatments sodium stebogluconate and amphotericin B. So the next time you hear Leishmania Donovani, imagine this entire scene. The Leishmania van, the sandfly transmission, the massive spleen, the black fever, and the macrophages filled with LD bodies.